Welcome to this video lesson on the setup and use of the Medtronic Becker external drainage and monitoring system. This lesson will provide a brief overview of the external ventricular drain, also known as an EVD. We will also cover step-by-step instructions on how to manage the system. The EVD is placed to relieve elevated intracranial pressure caused by conditions such as hydrocephalus, traumatic brain injury, or intracranial hemorrhage. It helps drain excess cerebrospinal fluid and monitor ICP, ensuring the brain remains safe from damage due to high pressure. First, let's review the key parts of the drainage system. The ventricular catheter, as shown here, will be inserted into the brain's ventricle. Then the catheter will be connected to the drainage tubing and collection system. This is the patient's line stopcock. You should make sure this connection is tight. Bedside nurses should never access this stopcock. As you move up the line, you will find the main stopcock. This provides connections to the patient transducer and drip chamber. Finally, it is important to note the pressure scales. We typically use the side that annotates millimeters of mercury. To level the EVD, align the transducer with the patient's tragus. Leveling the EVD to the tragus is crucial because this ensures that the pressure readings are accurate and reflect the true intracranial pressure. If the EVD is not properly leveled, the readings could be either falsely elevated or decreased, leading to incorrect clinical decisions and potentially harmful outcomes for the patient. Zeroing the EVD is crucial for accurate ICP readings. First, turn the stopcock so that it is off to the patient. Now lower the drip chamber down to 0 millimeters of mercury on the pressure scale. Remember that the hydrophobic filter on top of the drip chamber allows the system to be open to atmosphere when the stopcock is turned off to the patient. Because of this, no cap should be removed when zeroing the system. Use the Philips monitor to set up one of the ports for ICP monitoring. You may need to change the label to ICP. With the stopcock turned off to the patient, push the 0 button on the monitor. You will hear 2 beeps come from the monitor when the zeroing process is complete. Now return the stopcock so that it is open to the transducer and closed to the drip chamber. You will now be able to view your zeroed waveform and an ICP measurement. Don't forget to return the drip chamber to the prescribed level prior to opening the stopcock to drain. To obtain a tidal measurement, also referred to as a manual measurement, raise the drip chamber to the highest setting using the flow chamber locking bracket. Then turn the main system stopcock to off to the transducer. Note the fluid level inside the tubing in relation to the scale on the system. Adjust the drip chamber to the prescribed level, ensuring the system is either off or open per the provider's order. Make sure you verify this order each shift. To drain the CSF fluid that has accumulated in the drip chamber, open the 2 slide clamps so that the fluid will drain into the collection bag that is below. Do not squeeze the drip chamber because that could cause it to break or crack. If this happens, the entire system will need to be replaced. Changing the drainage bag is a 2-person procedure. First, turn the stopcock off to drain and assure clamps to drip chamber are closed. Put on mask and gloves. One person should have sterile gloves, the other can have on clean gloves. The person with clean gloves can now detach the bag, ensuring the connector does not become contaminated. Now, the sterile gloved person can attach the new bag, ensuring sterility is maintained. Once the new bag is reconnected, the old bag should be disposed of in a red biohazard bag. That's it. Now, reopen stopcocks and resume drainage. Thank you for watching our instructional video on the external ventricular drain. Proper use of the EVD is crucial for patient safety and effective treatment. If you have any questions, consult your healthcare provider.